Perfect. So please be informed that this session is currently being recorded, and if you prefer not to be recorded, we kindly ask that you exit the meeting, and your understanding and cooperation are greatly appreciated. And you can go ahead to slide 2, Dawn. Again, welcome everyone to the second day of the National Indian Health Board's American Indian Alaska Native Maternal Health Promotion Institute. My name is Alicia Sneddy. I am an enrolled member of the Navajo Nation in New Mexico. I serve as a public health policy and programs project coordinator, and I support our maternal health programs here at the National Indian Health Board. And it's an honor to be in this space with all of you. So before we get started, I want to take a moment for today's opening prayer, and Dawn Landon, our Tribal Oral Health Associate from the Oto, Missouri, Kiowa, and Iowa tribes. And I'll pass it over to you, Dawn. Thank you.
Good afternoon, everyone. Thank you, Alicia, for the introduction. And I want to thank each and every one of you for taking the time to join us today. Please ask if you would like to pray in your own way and own methods. That's perfectly good if you would like to do that. So we'll just take this moment and I'll provide the prayer for us. Thank you, our Creator, for providing this moment for us to share this wisdom and knowledge to each and one of our participants today. I pray that you just guide everyone that's working hard to make changes and make differences into our tribes and our nations with maternal health. And I just pray that you just help each and every one of those that are parents, expected parents, that need this information, that some way it can guide them in their hearts and anything that they may need. Just be with the families that are having missing children today, Lord, and that you just bring them home safely to them, and that they're going to be safe and brought home to their families. I just pray that you just be with those that are in mourning and be with those that are needing your healing today, and that you just continue to guide them and continue to guide each and every one of us today, and that for those that are traveling, that they make their destination safely. And thank you for just providing us again with the knowledge and the beauty that you provided us as Indigenous nations, and that you may comfort us in times of our needs, and that you just break those chains of the generational traumas that's affected us in our lives. And I just pray that you just help guide us, and thank you for the ancestors that you provided, the foot of these paths that we can walk on, and that we may continue to break new boundaries and to make big changes into our tribal nations. And thank you for our guidance and for everything you provided. Amen.
Well, thank you, Dawn, for leading us in a meaningful opening prayer and grounding us for today. So we're happy to have you all here for day 2. It's going to be another day filled with lots of insightful presentations and discussions. But before we jump into going over the agenda for today, I want to take a moment to shortly recap some of the highlights from yesterday's presentation. So we had the privilege of hearing from experts who shared their knowledge on a range of critical topics, including maternal mortality review committees, MMRCs, and the formative work being done in that area. And also with our partners with the Northwest Portland Area Indian Health Board and their presentation on American Indian, Alaska Native, Two-Spirit, and LGBTQ plus perinatal care, and as well as the vital theme of birthing sovereignty that was led by Dr. Socia Love Thurman, and the presentation on revitalizing Indigenous birthing communities and learning more on what that looks like. So if you were unable to attend any of those sessions, I want to reassure everyone that we will have the recording YouTube link and the slides available once the Institute has concluded, and we'll work with our communications team on getting those materials accessible on our YouTube channel, website, and you'll also be notified via email. So I encourage everyone to share those resources once they have been made available. And please reach out to me if you need any assistance with that, and I'm happy to help out in any way that I can, whether it's connecting you with someone or just finding some time to chat too. Go ahead with the next slide, Dawn, please. So for today's session, we have another exciting lineup of engaging presentations that will continue conversation of maternal health promotion in Native communities and exploring different solutions. And you'll see we have 4 major sessions for today, and we have a break around 2:55 p.m. Eastern time. And throughout the day, we'll encourage all of you to continue being actively participating. So I really appreciate everyone just sharing resources and the contact information in the chat and asking questions, unmuting your mics and just sharing your insights, because I'm also learning myself, and I really do enjoy learning from all of you and our speakers. And I really do believe with our collective efforts is what makes this institute a space for meaningful collaboration and growth.